is sunshine.
I don't really know how to follow that. My name's Anna, and I, like Clinton, use both health and social care, and I have had mixed experiences of both, I would say, over the years. You'll hear a bit more about mine later. And I'm co-chair of an organisation called Coalition for Collaborative Care, and we are all about promoting personalised care within health, and we work very closely with TLAP as our sort of system partnership in social care. Yeah, so I'm afraid I'm sort of being the bit of the bringer of the doom and the gloom, but bear with us, it will get better. So my first question really is why? Why do we need social care? Why do we need a social care future? What's wrong with now? Are we all happy? And I think, as a sector, we hear a lot about there's a crisis, there's a lack of funding, social care, it's all kind of negative. The media talks about NHS bedrocking a lot, that's when you often hear about social care. People like me who need social care, we often receive quite a limited service and we're not getting the life that we want to live. And people working in the sector, when I talk to them, often feel really stressed, overworked, burnt out. People are leaving at quite a high rate. So it seems to me like we do need to rethink what we mean by social care, and we need to define what we want that future to look like. So for me, this future has to be for everyone. It has to be for the whole of society, but also for the people working in the sector and the people like me who access services. But I think we need to break down that divide between them and us, and it needs to be a coming together. It's good for the community, I think. Or tick boxing. And for people like me, it's to allow me not just to survive, but to actually feel like I'm thriving and living the life I want. So for me, I think we are all part of the solution, and that's why we're here today, to talk about the social care future and to start that conversation. How do we find that solution? It's not just all about money. I just want to throw that in there. I know that's important, but actually what we're talking about is more than that. So what do I want out of my life? What is a good life? And that will be different for everyone. All of you here, if I asked you right now, you'd all say different things to me. Some of you might, have a favourite football team, and supporting them is important to you, or your pets, or your family, or your job. And a lot of those things I think we just take for granted. We just get on with it in our lives. But for me, I was talking to someone earlier today, and I was saying, actually, if social care could be what I want it to be, what would that look like for me? And actually, it would be not limiting my life. So at the moment, I have to make a lot of decisions of what I can do based on if I've got enough hours of support to do that. So it limits me an awful lot. There's a lot of things I say, I can't do that, or I think I can't do this because I haven't got enough support to do that. And actually, for me, it would be about allowing me to live the life that I would have lived if I wasn't disabled, to just be getting on with a normal life and not having to make those decisions all the time based on the lack of social care. So at the minute, up until very recently, I got 5 hours a week for social inclusion. So that was 5 hours that I was basically allowed to go out, able to go out of the house to do anything other than Tesco shopping. And most of that went on hospital appointments, because they're not included in my personal budget. So I felt as a person very broken down into a whole load of tasks. I was sort of, I could be washed, I could be dressed, I could have my housework done, I can have my food prepped, but as a person I'm much more than that. I have dreams, I have ambitions, I want to work, I want to contribute to society, and I just wasn't being able to do that. And I think in our lives, you all and we all make choices all the time without even realising, hundreds of little choices every day. Am I going to have a tea or a coffee? What time am I going to get up? What route am I going to take to work? And as soon as you enter service land, some of those choices, a lot of those choices are sort of taken away from you without you even, wanting them to be, obviously. And I think self-directed support, things like the Care Act, choice and control, they're all wonderful phrases, but a lot of us are not experiencing that at the moment. People are finding their lives quite restricted. So I spoke to somebody recently at an event, and she was saying that the carers come to put her to bed at 8 PM every night, and she was about my age. And that's just not a normal life. for someone of our age. And last week, though, we were at an event, and this guy called Andrew, he's a learning disability, and he was telling us about this fantastic thing called Gig Buddies, which has allowed him to be friends with someone with similar interests to him. So he can now go out, he goes to football matches, to the team he supports, which is also in East Midlands, good team. He's gone to see Star Wars on the night that it opened at midnight because he's a massive Star Wars fan. He's been to Glastonbury, you know, he was just full of these life experiences that for most people, if you want to go to Glastonbury, you can just go, but actually as soon as you need some support in this country, it seems like a lot of people that then becomes quite a difficult thing for them to do. So for me, some of the obstacles, I think, and the reasons for some of these challenges are, one of them I think is lack of co-production. I think we need all the people to be working together to build a social care that works for everyone. So that's people with lived experience, that's carers, that's people in the workforce, that's voluntary community sector. People from really diverse backgrounds, they need to have a voice because we are the experts in our own lives and what works for people. I think some of it's about power. So we need people to work with us and not sort of do to us. And certainly when I get that letter that says I'm up for review, I feel terrified because I know that in that dynamic, the person making the decision on how many hours I get, whether to cut it or increase it, has all the power. It needs to not be sort of tick box. We need true co-production and we need true personalisation. You know, direct payments can be a fantastic tool if they're given to people with genuine choice, genuine control. And we need to come back to that root, that real reality of giving people that choice over their lives. And it needs to be really individual because each person is different. So for Andrew, he wants to go see Star Wars. For me, I might want to go and see, I don't know, ballet or something. You know, totally different. And we need to see everyone as individuals when, yeah. And then finally, I think for me, a big thing is trust. For me, as someone who accesses services, I feel there's a lack of trust. So I'm scrutinised at every turn. Every letter that I receive has in bold a threat that says if you do not send this form back within 2 weeks, we will stop your direct payment. And that's my interaction with my local authority, and that feels very much like I'm being accused or suspected or something. And actually, my life is quite rule-based. There's a lot of rules. I can't use my PA to pick up a prescription because that's a health need. I can only have, you know, I can't use my direct payment for this and that. And that's not a way to live a life, and that doesn't mean I can just get on with my life. But also I think there's a lack of trust for staff, and I think for our social care to really change, I think we need to allow people in the sector to try new things, to innovate together, to work with individuals and to be creative. So I think for me, I would just like to see more trust really between us all in the system. That's my reflections.
Thanks, Hannah. We can clap. So thanks for that pretty vivid description of the rhetoric-reality gap between what I think most people would agree are pretty positive policies, like the Care Act, and the lived experience, people's lives in reality, and that gap between.
Bring me sunshine